Hello and welcome, everyone. We're thrilled to have you here and can't wait to dive into today's topic: life after kidney transplant, embracing change and setting realistic expectations. My name is Shayla Harris, and I'm the Director of Administration at the American Kidney Fund. I'm also a 15-year kidney transplant recipient, and I'm honored to serve as your moderator today. Now, during last year's Kidney Action Week, we held a session on understanding transplant, your options, the process, and overcoming barriers. AKF has designed Your Guide to Kidney Transplant. This resource provides a complete overview of the kidney transplant process for those considering transplant and their loved ones. This can be found on our AKF website, kidneyfund.org. This afternoon, you'll hear from our panelists about post-kidney transplant living, including lifestyle changes, health outcomes, and tips on embracing the new change and setting realistic expectations. Now I'd like to introduce our amazing panelists for today's session. First, we have Kanai Hattori, is a nurse practitioner, the director of Abdominal Transplant Fellowship for Advanced Practice Providers at Duke University Hospital, and additionally a clinical instructor for the Duke University School of Nursing Acute Care Nurse Practitioner Program. Kanai's interests include education and quality improvement initiatives focusing on areas such as multidisciplinary team relationships, postoperative mobility, and reducing opiate use post-kidney transplants. We also have Jennifer Burns. She is a clinical abdominal transplant pharmacist practicing in the ambulatory setting at Duke University Hospital in Durham, North Carolina. She is involved in patient care, education, and research endeavors in the transplant field. She's a current PGY2 Solid Organ Transplant Residency Program Director at Duke, and Dr. Burns is actively involved in American Society for Transplantation through the transplant pharmacy community of practice as a member at large. She's also an officer for the North Carolina Transplant Pharmacy Association. Now, before we get started, I want to encourage everyone joining to please type your questions and comments into the chat box to the right. We will try our best to get to your questions during our Q&A segment at the end of this talk. Now, to start, I'd like to turn it over to Kanai to tell us briefly about having a kidney transplant as a treatment and discuss what people can expect after they have had a kidney transplant. Kanai?
Thank you, Shayla. Good afternoon, everyone. So my name is Kanai Hattori. I want to start off by saying that I have no financial disclosure. And this presentation is in the perspective of an advanced practice provider, so a nurse practitioner or physician assistant. And so some information that you might hear today might vary from institution to institution. On the next slide, the goal for today is to have an interactive discussion about what happens after the kidney transplant is done. So from the time that you receive an organ offer all the way through your hospital course, through your discharge, and talk about what that life after transplant might look like. I want to talk about how the kidney graft is monitored, and then talk about potential complications, surgical and medical, with the kidney transplant. On the next slide. So if I were to take a 10,000 feet view about the entire kidney transplant process, I think about the preoperative evaluation or pre-surgical evaluation to identify if you're a kidney transplant candidate. Then you have an organ offer, you arrive at the hospital, you undergo a kidney transplant, and then you have your hospital course, you get discharged from the hospital, and then you're on your way with your life after kidney transplant. So the part that I want to focus on this conversation today is that where that gray arrow is pointing to. So from that time when you get that call and saying, hey, come to the hospital, we have an organ offer for you. So before surgery, you come to the hospital, and this is the preparation for surgery portion. Some of the things that might happen during this phase is that you'll go over consent forms, both surgical and anesthesia. A lot of the conversations at this time is about consenting to the surgery. What surgery are you having? Potential risk and complications of that surgery. And then what are some other treatments you might need with this procedure? So a good example is blood transfusions, which some patients might require with having surgery. All the workup that's done during this phase is getting you medically ready for surgery. So there will be lab draws, EKG or electrocardiogram, and that's when they put that lead on your chest, get a picture of your heart, a chest x-ray, and getting a set of vital signs. The big goal for this phase is that you want to make sure that you're a good candidate for surgery itself. A good example is if you missed your dialysis because you were called in for an organ offer, you want to make sure that your electrolytes are in good ranges so that there's no concerns for arrhythmias or heart irregular rhythms. For surgical preparation, you'll get an IV placed in your arm. We'll take out dentures, jewelry, put you in a hospital gown, and get ready. And then the most nerve-wracking but exciting part is waiting for that surgery to actually happen. So the next slide, this is when you have your surgery, the actual kidney transplant itself. So you can see in the magnifying glass that there's the donor kidney. It comes with the red and blue blood vessels. So that's the artery and vein. And then we also take the ureter from the donor and connect it to your bladder. So you can see that the kidney transplant itself goes to your right lower pelvis or sometimes your left, but it all depends on your anatomy and the donor anatomy. You can also see that your native kidneys, so your original kidneys, are still left in place because taking out your kidneys could be another major surgery. And so we don't want to cause two major surgery in one setting. If your kidneys need to come out, then we might do that sometime in the future. So after your surgery, on the next slide, during your surgery, still ongoing. So some of the other things that might happen is that you'll get a Foley catheter inserted and possibly a ureteral stent. And the objective of these two items is to protect the connections that they made during the time of kidney transplant. So on the very right-hand side, you can see that kidney that was transplanted, you had the artery and veins, which is the blue and red vessels. And then you have the ureter, which is the yellow vessel that goes from the kidney all the way to your bladder. And that's what kind of helps transport the urine from your kidney to your bladder so you can pee. At the tip of that yellow tube, you can see a curved line or tube, which is the stent. And then the biggest concept behind these is that if there's trouble, let's say kind of plumbing issues where urine isn't flowing properly and it's backed up, that added pressure can compromise the connection that the surgeons made in the operating room. Typically, Foley catheters are taken out in about 3 days, and those ureteral stents are taken out in about 6 weeks in an outpatient setting. During your surgery, you might get a larger IV. Sometimes that's placed in your arm, sometimes in your neck. Some of these larger IVs can allow for different medications to be infused. And then some of these IVs can be used for dialysis. Depending on what happens in the operating room, you might get a surgical drain placed. Another name for these surgical drains is called Jackson-Pratt or JP drains. And these drains are helping us monitor if there's any concerns for bleeding. And then these are taken out before you get discharged to the hospital. But a small population of our patients do go home with these JP drains. And if that's your case, we'll go over about how to take care of these, and they'll come out at the time of clinic visits. And then if you have a peritoneal dialysis catheter, sometimes these are taken out at the time of surgery, but it's up to the surgeon's discretion. So congratulations, you had your kidney transplant done, surgery is over. So what happens next? Well, several things happen. One, we're looking at the kidney graft function. So the term graft is talking about the kidney transplant itself. We're talking about immune suppression. Are you tolerating the medication? Is the drug level adequate? We're monitoring or managing surgical and medical complications. We're trying to meet postoperative milestones. Is your pain controlled? Are you tolerating a regular diet? Are you ambulating? Have you completed all the necessary education? And then there's also medication management, which is a big part of our transplant management. So we're looking at cost analysis, affordability for transplant medications, looking at your home medications, which medication should we continue, which one should we stop? And then, as always, more education. So what does a typical hospital day look like? Well, depending on how far you are from your surgery, it's going to vary just slightly. But to begin with, you're going to have a lab draw once a day or more if medically necessary. You'll have frequent vital signs and also blood sugar monitoring. The goal with this is that not only are we watching your kidney function to see if the transplant is working, but we're looking out for other complications such as bleeding, such as infection, looking at your what we call hemoglobin or white blood cells. You also have what we say team rounds, where your transplant team, which could be compromised either by an advanced practice provider like myself, a kidney doctor, a surgeon. We have pharmacists, we have social worker, and sometimes our transplant coordinator. And they'll come by your room in the morning, go over your labs from the day, your vital signs. They'll ask you, how are you doing? How are you recovering? How's the kidney transplant doing? What's the plan for the day? What's the plan for discharge? And then they'll ask you, what questions or concerns do you have? Some of this visit might be very short because we see a lot of patients, but I want to ensure you guys that it's not that you guys aren't important. We're just trying to meet everybody in the morning so we can start being active with the plan of care. In the background, even though you might not see us every single hour of the day, we're doing prescription preparations, we're doing cost analysis, we're setting up home needs. So we're still working for your care. But don't hesitate to reach out to your team and say, hey, can somebody come back and give me an update? I just want to talk and spend more time about this transplant. What am I doing? How am I doing? And sort of things. The other things about your hospital course, we're always working on your postoperative milestones like ambulation and pain control. And on the right-hand side, you see this honeycomb picture. These are all these different people you might come in contact with during your hospital visit. You might not meet everybody. A good example is a psychiatrist and a psychologist. So a lot of times, transplant is a big life event, and patients might need stress management, psychiatrists, psychologists for their support. You might not need some support, but we'll see. We'll tailor your care to your needs. So on the next slide, the kidney graft function, how do we monitor that? So graft function, we look at labs, which is not just the creatinine, but your electrolytes. Are you having a good control of electrolytes and minerals? And then is your creatinine coming down? Your urine output, are you making urine or are you not making urine? And the function of a kidney transplant can be divided into three. We say immediate graft function, where the kidney transplant works right away. Slow graft function, where the kidney transplant is doing okay. We're still waiting for recovery, but you're not at the point that you need dialysis to help stabilize you. And delayed graft function is we're still waiting for renal recovery or kidney recovery, and you require dialysis. The indication for dialysis is typically because since you're not making urine, you could be what we say volume overload or have a lot of extra fluid that you might need some oxygen, you're having trouble breathing. Or sometimes it's because of electrolyte imbalances. So if you have a high potassium because the kidneys aren't filtering, you might need dialysis. Now, a lot of the kidney transplant doctors that I work with and the kidney doctors that I work with, they say that 1 out of 3 kidney transplants have delayed graft function. And this is because our kidneys are very, very sensitive. But this is not a complication of surgery. It's just that part of the transplant game. So on the next slide, I want to talk about potential complications with a kidney transplant. So bleeding can happen at all sorts of different places. You can see on the right-hand side of the picture, there's the blue and the red vessel, so your artery and your veins. Any connection that they make could be a site for bleeding. Depending on severity, you might need a reoperation to fix that connection. If it's very minor, we'll give you blood transfusions. Similarly, blood clots can happen at those vessels, but also you can get a blood clot in your legs or your lungs during the hospital stay because after surgery, we aren't always ready to walk multiple laps. Depending on where the clot is, the management might differ. Sometimes you use blood thinners, sometimes it requires another surgery. Urine leak, similarly, where the ureter is connected to the bladder, that could be a site for bleeding. And as previously mentioned, this is why the Foley catheter and the ureteral stent could be important to be in place. Infection could be hospital-acquired or donor-derived. So an example of a hospital-acquired infection could be urinary tract infection because of a Foley catheter or hospital-acquired pneumonia. Donor-derived infections can be something such as the donor had a positive urine culture, and that at the time of transplant, we didn't have the final speciation or the final organism to treat it with. In that case, we'll do an infectious workup for you, and we'll give you some empiric antibiotics just in case. Primary non-function is a very rare complication. If there's multiple insults and the kidney never gets a chance to recover, sometimes the kidney does not recover at all. If that's the case, your team will talk to you about, hey, let's talk about relisting for another transplant. Rejection, our immune system is robust. They're always trying to prevent foreign bodies such as transplant, which is the reason why immune suppression is important. But if you do get rejection, we have different treatment options. Reoperation is a possibility, again, such as for bleeding or a blood clot, and then death is a rare occurrence. So when I think about life after transplant, that starts after you had your surgery all the way to week 1, to week 2, to 15 years, to 20 years, all the way down. So these are some tips that I want to share with you guys about life after transplant. So 1, follow-up visits aren't just about graft and surgical recovery, but it's also about modifications on your needs. So when can you go back to work after surgery? Can I start lifting weights? But my tip for you guys and for the audience is that always advocate for yourself. Ask questions and share concerns. When I said earlier about rounds sometimes being very quick and short, you don't always get the opportunity to ask questions. Don't hesitate to say, hey, can somebody from the team come back and talk to me? The second point that I want to make is the medication immune suppression tolerance. So medication and your immune suppression to prevent rejection is going to be part of your lifestyle for a long time. But one of the difficulties with medication is that a lot of medications will interact with each other. So always talk to your transplant team, your transplant pharmacist, about starting new medications or supplements to make sure that they don't affect your transplant medications or anti-rejection medications. Additionally, if you have financial and or non-financial difficulty getting your transplant medications, try to talk to your transplant team. There's always resources that we have to help you. Okay, so don't ration those medications. Just contact your transplant team immediately. Mental health. So mental health can be challenging. We sometimes think of mental health as the diagnosis of depression, but sometimes it's not a diagnosis of depression. It's just about your emotions being high and you have your lows, and that's okay to have. That's expected. Transplant is a major life event. And it's easy for us to say, hey, it's because of the steroids. That's why our emotions are so up and down. But use your transplant team and maintain an open communication. So some of the mental health struggles that I've encountered with my patient population is coping about getting a kidney from a deceased donor, adjusting to the lifestyle. So now you had your transplant, the kidney's working well, but you have to come back for labs very frequently. You have lab appointments once a week, sometimes twice a week. And if there's any concerns, such as infections, you'll be readmitted to the hospital. And then in the rare occurrence that you have primary non-function or the kidney transplant doesn't work, how do you cope with that? So ultimately, use your transplant team, maintain an open communication. We have a lot of different resources to help you through this. The next slide talks about immunocompromised diet. So now that you're on anti-rejection medications, we want to make sure that we reduce the possibility of bacterial or viral infections. So a good example, buffets, raw or uncooked meat, unwashed fruit and vegetables. We have dietitians in the hospital that will give you further education about what these diet might compromise of. Family planning and sexual health. So some medications that we use for transplant can affect pregnancy. So it's very important that if you're going to talk about family planning, you talk to your transplant team so we can adjust your medications for you. And then for sexual health, some medications like Viagra can affect blood pressures, especially right after surgery. We want your blood pressure to be higher than low because our kidneys are very, very sensitive. So don't be shy about your medications. Don't be shy about sexual health. Talk to your transplant team. And lastly, caring for our friends and family. So caregiver burden is very real and it happens often. Our caregivers are coming to the hospital to help you with your transplant process. They have to go home, take care of your kids, come back to the hospital. And they also go through a lot of education that our patients go through. How to administer insulin, how to avoid needle stick injury if you have a donor with hepatitis C virus. They get all the education about transplant medications. And so they get a lot of teaching that you guys go through. And so sometimes that can be a lot. So in summation, if I had to give one piece of advice for everybody, I would say always contact your transplant team for any concerns because they will help you. They have resources to help you out. Thank you.
Thank you, Kanai. That was great information and brings back memories of my transplant days. If you're just joining us, welcome to our session on life after kidney transplant, embracing change and setting realistic expectations. As a reminder, we will take questions at the end of our time today, but you don't have to wait until then to send your questions. Please type your questions and comments into the chat box, and we'll try our best to get to your questions during our Q&A segment. Now, one quick question. What are some common concerns patients express about living with a kidney transplant, and how can they best prepare for these changes?
Yeah, I think one of the biggest concerns that I hear about is what if the kidney doesn't work right away? What does my life look like? So, as said previously, 1 out of 3 kidney transplant might not work right away. You might have delayed graft function needing dialysis. So once you leave the hospital, if you're still on dialysis, I would say don't panic. It is very common. It is sometimes expected. And if that's the case, if you're worried about it, talk to your transplant team and they'll walk you through the process of why the kidney is not working, what they think. So I would say maintain an open communication, be transparent. But if the kidney's not working right away, it is okay. It is expected.
Great, thank you. Now, Jennifer, you play a huge role as a pharmacist in the post-transplant journey. Can you share with us some things patients can expect with their post-transplant medication?
Yes, so we'll take time to kind of review all of our meds here because the transplant medications are one of the very most important things that you guys will be in charge of. And I'm excited to kind of lend some of this information to you as we review all of these new things that you may have never seen before. So overview, we're going to give basically what the role of the transplant pharmacist is on the team. So we'll tell you what the pharmacist is in charge of. We will review during this session common medications that are taken after transplant. We'll also talk about how to manage meds because it's a complex regimen and there's a lot of new meds in it. So we'll talk about those management strategies, and then I'll give you some tips and tricks that might help you succeed as it relates to these medications. Then the role of the transplant pharmacist. So you will have a transplant pharmacist on the team in the pre-transplant setting when you're getting your evaluation, and also in the post-transplant setting. So before you get your transplant, the pharmacist, what they do is they are responsible for reviewing your medications. So bring an up-to-date med list to your evaluation appointments so that we can make sure we know what you're taking. We will ask you about your medication allergies, and we'll help take all this information and put it together so that we can design a safe regimen for you and make sure that we tailor make it specific to you. After the transplant, there'll be a lot of new meds. You probably haven't heard of these. Maybe today you'll be a little bit more experienced through our talk, but they're new meds. We're going to take time. The pharmacist comes by in the hospital and sits down with you and your caregiver, and they talk to you about what the medications are. Why are you taking them? How do you take them? What are the times a day that are the best to have the medicines organized? And we'll help do that also in the outpatient setting. So when you come to clinic, you'll have a pharmacist that will meet with you multiple times to just help you through this process. And the pharmacist will also work behind the scenes. We review, with the team's help, of course, we review all of the medications you're on. We look at your renal function because some of these medicines actually have to be adjusted based on how well the kidney's working. We'll look at lab values like your blood counts. We'll think about the side effects when we ask you about them, like are they attributed to the medicines or is there something else that may be going on? So we'll piece all these together to make sure we have a safe and effective regimen for you. And on the next slide, we'll talk about why you actually need these meds. So you've heard that you're going to have to take medications, but what is the real reason that we will add all these new things to your regimen? And the big piece, and Kanai kind of talked about this, is first and foremost, we need to prevent rejection. Like he said, the immune system is robust. It is responsible for helping to protect us, protecting us from bacteria or viruses, and it thinks it needs to help us protect our bodies from this new kidney that you're getting transplanted because it's not part of you. So it wants to fight it and get rid of it. We don't want that. We went through all of this to get a new kidney transplant to live a healthy life. So we need these medications to help us prevent that rejection risk. Now, when we suppress your immune system, it puts you at risk for infections. So there are certain things that we need to think about, bacteria and viruses that we may need medications to help us until we can lower the amount of the medicines you're taking or the doses so that your immune system can help you and continue to keep you healthy. And then some patients will need meds just to overall maintain good health. And this will be very specific to you for blood pressure, blood sugar, or other things that you may have had before the transplant. So we put all that together and make sure we have a good list of everything that you need. Now we'll take it stepwise and go through each one of these. And on the next slide will be our first kind of subsection of our anti-rejection medications. So the medicines that are very common that most of our transplant patients will take are 3 meds that are orally, so they're swallowed, and they're taken at different times of the day. But the names of them, so you can start getting accustomed to hearing these, are tacrolimus, or brand name Prograf, which are those capsules that are white and red. They may look a little different depending on the pharmacy that you're using, but they're typically capsules. Or Envarsus, which are the tablets there with the TCS and number 1 on the other side. This is one of the most important medicines that you'll take, but it'll be coupled with mycophenolate or brand name Celcept, those blue and orange capsules, and then prednisone. You guys have probably all heard about prednisone, but these 3 medications are common and what we have most of our patients taking, and they work in different ways to suppress the immune system. So we will use them. And the next slide will show us the backbone. So the tacrolimus, that Prograf or that Envarsus, this is the most important medicine of your regimen. It is, if you're taking the capsules, we take them twice a day. So we ask our patients to take them in the morning around 9 o'clock in the morning and in the evening at 9 p.m., 12 hours spaced apart. If you're taking the tablets, they're only once a day, and you'll take them in the morning first thing, and it lasts for 24 hours. But what's interesting about this medication is the dose and the number of pills that you take are actually very specific to you. So we look at your blood levels, we monitor them very closely, and we ask you when you come to clinic or when you're in the hospital, we will have you hold your tacrolimus. Don't take it, get labs first, and then take the pill right after. And the reason is that is the best time to see how much drug is in your system before you take the next pill. And that way we can always make sure we have enough to prevent rejection. As you go, the amount of pills that you have do go down with time. So we'll have the most kind of upfront after the transplant because your immune system is going to see this kidney and start freaking out a little bit. But we'll suppress it, keep everything calm, and we'll lower that dose as we go. And some of this on the next slide, some of the side effects that you may experience, and I will say not everyone does, but these are ones that I like to let you know about. So if it happens, you can know it's medicine related. It's not just me with something happening, but tacrolimus sometimes can cause patients to have headaches. And you can let us know if you're having consistent headaches. So these are ones that may be happening at the same time of the day, and it's happening every day, and it may be related to the medicine. It could be also just a headache related to dehydration or stress. So we have to kind of think about what is happening and what is related. Some patients can get tremors. These are shaky hands. So you may have never had a tremor, and now you've got these kind of shakes. And it does get better with time. Your body is designed to compensate and to, over time, kind of build up a tolerance to some of these side effects. So things do get better with time. Tacrolimus can also, for some patients, increase blood pressures, and for others can increase blood sugar. So we'll have you monitoring both of those if we see that you are in need of it. The next slide will be our second medicine in our arsenal for preventing rejection, and that's mycophenolate, or brand name Cellcept. So this medicine, it's given as capsules, typically 250 milligrams strength, but we give you 4 capsules in the morning to take right along with your tacrolimus, and 4 capsules in the evening to make 1,000 milligrams twice a day. And we keep that dose the same. So we find what dose works for you. We keep it the same, no blood draws, just take that dose. And for some people, they can have a little stomach upset with the medicine. Most of our patients tolerate it well, but some people can have a little nausea, take it with food. That helps to kind of cut that potential for vomiting. And some patients can have looser stools related to this medicine. The next slide will show us our third, prednisone. And like I said, most people have heard of prednisone before. People take prednisones if you ever had a rash, or if you had bad pneumonia, or if you had gout. Some people will take prednisone. And prednisone is a great anti-inflammatory. And it also is a great drug to prevent rejection. So we use it typically at higher doses after transplant. We give it once a day, and we will taper it down and get you, for some institutions, we'll get you off of it entirely. For others, we'll just have you on 1 tablet, 5 milligrams a day. And the reason why we taper it down is because it does have a couple of side effects, and you may have heard about some of these. Prednisone can increase blood pressures. It can make your sugars higher if you have trouble with diabetes, or if you've never had diabetes. Sometimes your sugars can be higher just because of the medicine. Some people can get moody, so some emotions, you get more angry or irritable, or some people can get sad. And I know Kanai kind of talked about we need to know about how you're doing, because it may just be the stress of having a new transplant, living a new lifestyle and a new routine and regimen. So it may not be drug, but often it does cause some lability in the moods. And then for some, it is a very stimulating agent. So some people can have trouble sleeping because your mind is racing and you're thinking about all the things you need to do, and it can be related to the medicine. So we lower the doses as we go and get you on a safe amount that does not lend to having many side effects. So those are all the anti-rejection medicines that we'll have you take to suppress your immune system. The next slide sets will talk to you about preventing infections. Because we've suppressed your immune system, we need to make sure we protect you. And one of the things that we're protecting you from are potential bacterial strains, bacteria that can cause pneumonias, lung infections, or ones that potentially can increase the risk for bladder infections or urinary tract infections. There's a very common tablet that a lot of people have taken in the past. If you've ever had a urinary tract infection, it's called Bactrim, trimethoprim sulfamethoxazole. But Bactrim dosed 3 times a week or once a day, depending on the institution you are, that is a very common medicine. And if you ever had an allergy or intolerance to Bactrim, some folks may be on atovaquone. It's a liquid medicine that you will take once a day. But these antibiotics you'll have for the first year for most institutions to help protect you when you're on these higher doses of the anti-rejection medicines. The next slide is a picture of viruses. So we use medicines as antivirals because there are certain viruses that you may have been exposed to in the past, or maybe your donor have been exposed to, like the herpes simplex viruses, or there's a new virus that you probably haven't heard about. It's not new, but new maybe to you, the cytomegalovirus, CMV. It's a very common virus. 80% of us have all been exposed to it, but we just don't think about it. Our immune systems keep it in check and do good. But after we suppress your immune system, sometimes that virus can wake up. So we use medicines like acyclovir or valganciclovir to protect you from certain types of viruses. Usually these are only given for the first 3 to 6 months. After that, we don't need those because your immune system will keep it in check like it always had previously. And then the third on the next slide, the next section that we'll do, the third section, is about health maintenance. So there are quite a few medicines that you may have taken before transplant, you're taking now, that we will restart. And then there are some new ones that you may not have been on. But one very common medication we use is aspirin. So aspirin, low dose, 81 milligrams. This one is a good one to help prevent blood clots, where they sewed the kidney in so that we can keep the kidney healthy and happy. So everyone will get an aspirin at most institutions. Most transplant centers will also give you a medicine to protect your stomach. So famotidine or Pepcid or omeprazole, Prilosec, those are very common ones that we may use to help protect your stomach. And then some patients may need blood pressure meds. Can I kind of talk to you about, we do like higher blood pressures during the very first couple of weeks after transplant, but then there will be a time where we want to get your blood pressures to goal, less than 130/80. So we'll work to add medicines if you need it. And then the fourth one is some patients may need blood sugar medicines. And you may never have had sugar issues before, but sometimes we may have sugar issues in the transplant setting. So there are oral medicines or potentially insulin that we may need to give to help with health maintenance. Now, what about those over-the-counter meds and those herbal supplements? The next slide shows us the non-steroidal anti-inflammatory drugs, these NSAIDs. NSAIDs are something that we all have in our medicine cabinets. But after transplant, you're going to have to take it out, throw it away, or if you got a friend you can give it to, then you can donate it. But the NSAIDs, medicines like ibuprofen, naproxen, indomethacin, diclofenac, these are medications that often, even in the dialysis, if you're on dialysis or you have kidney disease, your nephrologist may say no. But after transplant, we say no because what it can do is it can cause kidney injury. That, in addition to our medicines that we're giving you to prevent rejection, can be a little tough on the kidneys. So we say no to the NSAIDs. Tylenol, acetaminophen will be your go-to for pain after. And then we also have other pain meds that we can use if you have hard to control pain. The next slide talks about over-the-counter medicines. So we do want to know what you take before you take it. So that includes prescriptions not written by your transplant doctors, and also these over-the-counter medicines that you can get at your local pharmacy. And the reason for that is because some of these meds can affect your transplant medicines. They can increase the concentrations, or they can make your transplant meds not work because they bind them up and don't allow them to work well. The medicine's typically safe, but please always check with your transplant center for cough, congestion, diarrhea, allergies. They're very common ones, but I've listed them here just so you can kind of see that we do have medicines we can use. We just need to know about them first to be able to pick the safe ones for you. Herbal supplements. These are ones that get a little tricky. There are a lot more herbal supplements these days than there were 20 years ago. And everything is kind of geared or touted to do a certain magical thing to be able to help support our health. But these medicines, these herbal supplements, are not approved by the Food and Drug Administration, the FDA, for safety or how well they work. So even though the label says that it's going to do this certain thing, it's not been validated or studied that it actually will by a big agency. So it's one that we do want to know before you want to take these, because a lot of these supplements do interact with your transplant medication. So we need to, the pharmacist will pull up, we've got databases that have case reports and all of these different things that we can look to make sure that it also will be safe. This includes herbal pills, herbal teas, and topicals, because some of those topicals can actually get into your bloodstream. So we need to know what you're using before you restart it after transplant. So bring in your medicine list so that way we know what you're taking and what you may want to take after you receive a transplant. The last section that or one of the last sections we'll kind of talk about here are the medicines that you are taking now. What do we do about those medicines? And we, like I've kind of talked about, that we need to know what you're taking to make sure that we make a importance or weigh the importance of whether or not you need to take it after transplant, because a lot of the meds you're taking we don't need. You're going to have a functional kidney and it's going to filter and it's going to do what we need it to. So those phosphorus binders or the renal vitamins or those fluid pills that you took before, we may not need to restart. So bring that med list. We'll talk about this at your evaluations, any annual visits, to make sure we restart what is important for your health. And the next piece will be about managing your meds. So you will have, on the next slide, there's a picture here of a pill box, and this box represents all the different times of day that you may be taking meds. Some patients may only be on twice a day meds. Some patients may be on 4 times a day meds, but often the transplant center that you are at will give you a pill box that looks like this, and it has 4 slots a day for 7 days a week for a pill planner for the full week. And the pharmacist will sit down with you and help you fill it out, or you can fill it out with your caregiver. But this is important to keep, because this is one of the strategies that we can use, keeping a pill box to keep all these meds together. So it's easy, just pop it out for the morning, midday, and in the evening, so you can be able to take the medications and keep it on a good schedule. But honestly, in the big scheme of things, all of these meds and this management and everything, it's good to have a team, have a caregiver, have a buddy, have somebody that you know that can sit down with you. Somebody fills the pill box, you double check it, or you fill the pill box and your caregiver will do the double check. That way, 2 sets of eyes, better than one. You can make sure what is there is correct, because these medicines are the most important thing that you are in charge of and making sure are correct. There are a couple of tips to help you in management. The very most important thing is, remember to take the pills. Don't forget them. I know that seems a little simple, but life is busy. There's a lot of stuff going on. We're going to ask you to be monitoring your blood pressures and your blood sugars and your weights, and then you got to come to appointments and bring your meds. Always make sure, think about those meds first. This is what's going to keep you healthy. This is what's going to keep that kidney in your body and not rejecting. So don't miss any doses, because it can lead to rejection and you can lose the kidney because of missing doses. Set alarms, get a routine, breakfast, lunch, dinner, bedtime. Those are my times. I always keep them kind of set in my brain of when I'm going to take my pills, and get that buddy system. Get your friend to give you a call and say, hey, Jennifer, did you take your pills this morning? And you'd be like, yes, I did. Thank you for reminding me. But it's always nice to be able to have that system in place. Also, stay on top of getting your refills on time. Make sure you call the pharmacy a week ahead, or get into those automated refill processes with the CVS and the Walgreens. Is great. They will alert you that it's time to pick up your meds. But always look at those pill bottles to know how much you have and when you should get the refill next. And if you ever have trouble getting your meds, please call your coordinator. Your transplant coordinator will be your best friend. You can call them at any time. There's an on-call at night. There's the coordinator during the day. You can send messages, and they will help you figure out how to get your medicine. And this is also very important if you ever have a change in your insurance because you went to a new job and they now have you on a different plan, or if you lose your insurance because life happened and you lost that insurance, please let your coordinator know as soon as possible so we can help you figure out what to do next. And we will tailor make your medicine regimen specific to you. This is an example of a pill graphic, a little chart that we give our transplant patients here at Duke that has the list of the transplant medicines on the left. We have the dose and the number of pills you need in the second and third column, and then the times of day to take those pills listed out, and then little helpful notes on the right-hand column. But we will put this all together. We'll give this to you. We'll talk through it so you know what to do and how to manage your medicines. And on our last slide, remember that this is all a big learning thing. We're in it together. We're learning you. You're learning these meds. We're all coming together. You have a team that is there and designed to help you. So a lot of opportunities for you to ask questions, and a lot of folks will help remind you things and when we get labs and what the doses should be on the meds. But ever in doubt, ask questions because we are definitely here for you and a part of your team. Thank you, guys.
Awesome. Thank you, Jennifer and Kenai, for sharing such great information and tips on healthy living after kidney transplant. But before I turn to the Q&A part of the talk, I'd like to remind the audience to visit the resources section on the Kidney Action Week website to view some resources related to this topic. Now, let's turn it to the audience questions. The first question is for you, Kenai. Have you witnessed a case where a patient develops a cold or something similar when an organ is available for transplant, and how is that addressed, and what are the possible impacts of that for moving forward with transplant? Kenai?
I think you're on mute.
Sorry about that. Can you guys hear me okay?
Yes.
Great. So great question. So during that conversation about that pre-surgery phase with the surgical and medical preparation, there have been cases where patients either have a urinary tract infection or sometimes even COVID. And the big thing is we want to do the surgery in a safe manner. And so in this situation, depending on what's happening, surgery can be canceled. In that case, we will treat you medically, so you'll be admitted to the hospital. And unfortunately, the organ will go to somebody else that's ready for surgery. With that said, when there's another organ available, they will give you a call for your surgery. But bottom line, this has to be safe. We want you to be successful. And so we don't take any risk. Keep in mind that we give you a lot of immune suppression as well. So,
great, thank you. Now, this next question is for Jennifer. Some kidney recipients, it's been heard that later need a liver transplant. Can anti-rejection medicines affect the liver? If so, are liver functions tests done, and how often are they performed?
So thank you for that question. I'll say it's quite rare for kidney transplant patients to later need a liver transplant unless they had cirrhosis coming into the transplant or some underlying disease state. So the medicines, they're metabolized, they're broken down by the liver, and most of the medicines that we give you are not toxic to the liver. That's not one of the normal side effects. We do monitor liver function for some patients that may have had underlying issues, and we do, if you're ever readmitted to the hospital, we're always checking things. So it is part of a panel that we do order, but it's just not very common for that to happen unless there was something that before the kidney transplant you were at risk, and we needed to monitor closely because of that.
Okay. And another question for you, Jennifer. Is it unusual to not have prednisone as a part of the medication regimen?
Yeah, so prednisone, like I said, great drug, does a wonderful job to prevent rejection, but because of all these side effects, we in transplant really try to think about how can we avoid prednisone? Now, prednisone, I will say, is in a lot of the regimens, and I don't want to dissuade anyone because prednisone does such a good job. But this is something that we actively talk about in the transplant world. So There are regimens I didn't talk about, but there's some injectables that we give you once a month. The medicine name is belatacept, that sometimes will allow us not to need prednisone, because here at Duke we do something specific. We do this belatacept in a pill form of an anti-rejection medicine that I didn't mention, but we put those together and it helps you avoid needing prednisone. At UNC, which is our neighbor right down the road, they use Prograf or tacrolimus and mycophenolate and no prednisone, because they give these strong medicines by the vein in the hospital that last for a year to prevent rejection, and they can get away with not needing the prednisone there. So every institution does something a little different. Often, though, if you look at the national trends across the nation, more than 70% of institutions are using tacrolimus, mycophenolate, and prednisone together. But ask when you go to get your evaluation, what are the meds that you use to help in the post-transplant setting prevent rejection? And you can, with your nephrologist and the team, talk about what's best for you. And as long as your insurance covers it, that's the other piece. Some of these meds are very expensive. So we do need to have that good insurance on file and make sure that we don't have a cost burden because of the medicines that we use.
Great. And then also, as for antibiotics, can they be harmful to the kidneys, and how is the impact monitored by the transplant team?
So we do use antibiotics quite a bit because we suppress your immune system. So some people can have risk for urinary tract infections or those certain pneumonias or skin infections. So antibiotics are very common. And because they are so common, we do know quite a bit about them and which ones are the safest to use. Often they are cleared through the kidney, so they're excreted through the kidney. So we renal dose adjusted. So some patients may be on twice a day and another patient may only be on once a day. And we do monitor the kidney function through the course of that. And if we ever see that there's any issue with that specific antibiotic and an uptrend on creatinine, we can dose adjust or pick another regimen, but we watch it very close and monitor. So don't be nervous about that because you do have your pharmacist and your practitioners that are very mindful, and we do this quite a bit with antibiotic use.
Great. And I have 2 more questions for the both of you. What are some tips that you may have for someone preparing for their transplant surgery in terms of physical and mental preparation?
Sure, I can go first. I think for the physical portion, the healthier and stronger you are going into surgery, the outcomes are much better. So trying to keep a healthy lifestyle with diet, exercise is going to be definitely key. And for the mental health, I was just say, kind of going off Dr. Burns, just talk to your transplant team. What medication do you use? Knowledge is powerful. So talk to your transplant team a lot, and that's going to help you a lot.
Great.
Yeah, and I will echo, the healthier you are coming into transplant, the better you're going to do in those first couple of weeks after. You can really bounce back. So making sure you are walking, even going to the mailbox, down the road, just some way to keep up your stamina. We do test and the evaluation to make sure your heart is doing well, but we want to make sure you are exercising, doing as much as you can so that you can be robust. Because that's a big surgery and you're in the hospital for a couple of days, and that can kind of take you back a little bit in your ability to get back up on your feet. So make sure you live a healthy lifestyle, and make sure too that from a mental health standpoint, we have great folks that you can talk to, psychologists, your medical team, because it's nice to get some coping strategies. Like, you don't always need meds, but coping, like, how do I deal with a stressful situation? Right. Now I'll bring out the med piece. Now I have to take meds 4 times a day. How do I do this? And we can kind of help you strategize. So again, like I said, just open conversation. Talk to us. We are here for you. We've done a lot of transplants at our various institutions, so we can help you because we've seen it, and have hopefully some things that can help you through your journey.
Great. Well, you just perfectly answered both questions in one, so that worked out perfectly. Thank you. So first and foremost, thank you so much to Jennifer and Kenai for joining us today and giving us some amazing information in regards to the transplant process. And on behalf of ACAF, thank you for joining us today during this session. I hope you learned as much as I did. And that is it for today. Tomorrow, tune in Again, to hear about the importance of diversity in clinical research to advance kidney health at 10 a.m. Eastern Time. You can also follow us on Facebook or send an email through kidneyfund.org to find more resources like there is CARE DX, AKF post-transplant testing webinar, as well as life after transplant. Now, once we conclude the session, you will see a link for a quick survey in the chat. Please take a minute to fill it out and tell us how we did today. Your feedback will be very useful as we plan future sessions. So thanks again, everyone, and have a great day.
Camp fun. The virtual camp means everything to me because I get to see other kids that have similar daily life challenges like myself. Also, seeing them make me not feel so lonely and different. The camp changed my life because I get the chance to connect with others like me, learn new fun projects, and the best part is that I get a fun surprise box every month.